In Richmond, 4-year-old French Bulldog Winston is coming in with his owner, Cara.
Hi, Cara.
Hi.
Hi, Winston. Hello, champ.
Winston is a popular visitor to the clinic.
There he is.
Especially with receptionist Kirsty.
How's he doing?
So he's got a bit of an embarrassing problem.
Oh dear.
You might want to have a look at. It's not very nice.
Oh.
You're not looking very embarrassed, are you?
No.
Perfectly
Looking
fine.
gorgeous as always.
Yeah. All right, well, if you've got an embarrassing problem, we should probably go in private and talk about it, shouldn't we? Come on then. All right, you got him, Cara?
Yep.
That's it. Good boy.
He's kind of everything, really. He makes us laugh every day, and he's very popular, and he's very sociable and quite outgoing. And yeah, I love him to death.
So, first things first, young man, embarrassing issue. I'm guessing it's the back end somewhere?
No, actually, if you get a bit closer to his face, I think you'll probably smell the problem.
Oof. Oof, my boy. Oof. Someone needs to brush his teeth. That is horrific. How long has that been going on for? Shocking breath.
It's been going on a few weeks now, and I've noticed some lumps in his mouth that's getting worse. So I just thought it'd be good to have a look at it.
Yeah, okay. Can I have a little look in your mouth, my boy? Whoa! Whoa! Oh my God, that is horrific, isn't it? Wow, it's like his whole mouth has been taken over by barnacles.
Yeah, because he's got the bulldog chops. Until we pulled them back and had a look, we just didn't realise.
And they're even on this side too. Look at that. Oh my God.
I've never seen anything like it in my life.
Body.
When the vet says, wow, it must be pretty bad.
So basically what this is it's the papillomavirus, so the wart virus that people have.
Yep.
Dogs can get it as well. And generally, it's only 1 or 2. You know, you might get maybe 5.
Yeah.
And after a few weeks, it generally regresses, they fall off and it goes away. How long has this been going on for?
About 6 weeks.
Oh, buddy. And he's such a tough little dog, this guy, so he wouldn't give much away, but when you open his mouth, I mean, that is so unbelievable because one of those is actually just going right between his molars, which should just be so uncomfortable. It's not that unusual for young dogs to have warts develop, and they come and then they go. But this case is extreme and incredibly unique. For a dog to have that many warts present in his mouth, it's nothing I've seen in the last 20 years. We are going to have to perform a procedure on you, my friend, to try and debulk, try and remove some of them, and then use some medications to dampen down the continued regrowth of more.
Yeah.
I think the best thing for us to do is to have him in today, give him an anaesthetic, and then harvest, if you will, these barnacles out of his mouth, and start giving him the comfort that he deserves.
Yeah, no, that's great. Thank you very much.
All right, then. Well, do you want to say goodbye to Mummy? I probably wouldn't give her a kiss, though, because with that breath, she won't thank you for it.
See you later.
Okay, then, Carol. We'll give you a call once he's woken up.
Thanks very much.
All right.
Thanks, Scott.
See ya.
Cheers. Bye-bye.
Bye.
It's never nice. You never want your dogs to go under general anaesthetic, especially the bulldogs who can have problems with their breathing as it is. And I'm hoping that he's going to be all right. He's in good hands. And I'd be devastated if anything happened to him.
So now we're going to sort them out. Yes. Needs a special bit of equipment. Yes, we are. You ready for this?
Go on. Wow. Okay.
I've just never seen anything like it.
No, I mean, I've seen 1 or 2, but that's like a colony.
Nathan's an experienced nurse, has seen a lot, and together we've worked on many cases, but we're both quite shocked by how severe Winston's wart problem is. I am going to be removing these warts by using electrocautery, so basically a pen that cuts and then coagulates the blood at the same time. So hopefully going to be removing these warts like a hot knife through butter, but it's going to take a while.
As well as making Winston much more comfortable, the surgery will also help kickstart his immune system to fight off the wart virus.
It's actually horrible, isn't it? Gross. Poor boy. Just imagine like how many of those are in between the top and the bottom teeth. So every time he chewed, he would have been biting on his own face. What a brave soldier he's been.
The warts are coming away easily, but there are so many of them, it's going to be a slow process.
Slowly getting there, but it's unbelievable. I've never seen anything like it.
In Richmond, Scott is treating a shocking infestation of warts inside French Bulldog Winston's mouth. While the condition is not life-threatening, it's likely at some stage Winston's immune system was weakened, allowing the warts to multiply at an alarming rate.
Just make sure we've completely cleared out this side. So can you put pressure on that? So you need to use your fingers to push it down halfway.
And Scott is shocked at how far the horrible growths have spread.
Some warts have gone so far down his throat, they're actually hanging into his airway. They're present in his soft palate, which is at the back of your mouth, and these warts are then going right into his larynx as a voice box. Nasty. Done. I'm really happy with that. It looks horrible now, but it will look a lot better soon. It's been a really long procedure, way longer than I thought because of just how many there were and how extensively they had spread. So he'll take a little while to recover, but actually I think he's going to feel a hell of a lot better than when he first went under. So it's a good result.
Winston will be started on medication to make sure the warts don't grow back.
I know. Oh, poor boy. Oh, no.
For now, it's time to sleep off the anaesthetic.
It's all right. I'll go and call your mummy. Good boy.
I'm really looking forward to seeing him, actually. Hopefully he's not going to get too excited. I don't know how sleepy he's going to be, but it'll be lovely to see him, and he's normally super excited even when I've been away for 5 minutes, so I'm sure he thinks I've left him forever.
Hello.
Hey, buddy.
So what's the first thing you notice?
The smell's gone.
Exactly.
That's for sure. My
No
God.
smell. Woke up with lovely fresh breath, didn't you?
He'll be a lot more comfortable.
Yeah, absolutely. Look, let me pass him to you.
Yeah.
Let me show you some of my handiwork. So they were absolutely surrounding, smothering the insides of his cheeks. They're under his tongue, they're on his hard palate, and then also on his soft palate. You can see the difference.
Oh my God,
Gone.
that looks so much better. Oh, good boy.
There you can see a little bit of healing to do, of course. It was a thoroughly disgusting process, but I'm really glad all those warts have gone and he should make a full recovery and feel a lot more comfortable. Do you want to see them?
Definitely, I definitely want to see them.
They're totally disgusting.
Oh my God, looks like something from the bottom of the ocean.
It really does. So I was thinking
it's
that looks like
horrific.
barnacles, doesn't it?
And all that in his tiny little mouth.
Yeah.
Absolutely shocked by how many were in his mouth. We knew there was quite a lot, but I'm pleased they're now in a dish, not in his mouth anymore.
All right, buddy. You sleep it off, eh? Better out than in? Yeah. All right, good boy. All right, Cara, all the best.
Thanks ever so much.
See you
Scott.
later.
Thank you. Take care. Bye-bye. Bye, Kirsty.